Yes, we are in Holland today, and our
Yes.
guest today is Arnout Orelio. How are you doing?
Yes, I'm fine. Thank you. Uh, just got everything ready just in time for our meeting. So thank you for inviting me, Jim.
Yeah, thank you for being here. Yeah, long time.
Yes, it's been. Yes. So,
Yeah,
but all good memories. So that's
all
always a
good
good thing.
memories, and right now everything is fine with you and the family. Everything is fine. Yeah.
Yeah. Well, everything but my health. So I have serious issues with. I have chronic migraines. That means that I well, I don't have too much time and energy to give to the world, but whenever I have, I do things like this to share my message. So thank you for this
Yeah.
opportunity again. So
Yeah. And today we will talk about lean thinking in healthcare. Now, the health is not that well, but we will talk about lean thinking in healthcare. You wrote like a book, and you're preparing another one. Maybe we start there with your book, lean thinking in healthcare. Like,
yeah, so the practicality is that I'm in the middle of launching this book with the same title, Lean Thinking in Healthcare, and the subtitle is Safe, Compassionate, Zero Waste, No Struggle. So you could say that's like the true north or the vision for healthcare for me is that it's safe, compassionate, without waste or struggle. So that's like the purpose of the book is to help people move towards that vision. And actually, although it's my second book in English, it's actually the same book was my first book in Dutch. So
okay,
in 2019, under the title Mensen Beter Maken, or in English, it would be Making People Better, I wrote a book because although there's a lot of books on lean and there's a lot of books on healthcare or even lean healthcare books, there's little to no information on how to actually change the culture and the system in your hospital or in your clinic, because most of the books are about the tools and the techniques and how you can do projects, and maybe you get them hand out when you do a green belt and all this
uh-huh.
stuff. But I felt that the thing we didn't learn from Toyota because we weren't looking good enough is what is in my book. I like to phrase it like that. And it took me 5 years to write this book in Dutch, and then I translated it now in English, and it will be published somewhere in the first quarter of next year.
Okay.
So that's
Yeah.
so as you said, there is another book, and they're a bit um, well, the one is a spin-off of the other. So this book, which is coming out, Lean Thinking in Healthcare, is more the concept and the thinking, and how you develop leadership in your organization. And the other book is called Lean Thinking for Emerging Healthcare Leaders. Like the title says, is more for individual leaders
Okay.
who think they want to change something for the better for their patients or maybe for their team. And that book describes what you need to do as an individual, how to develop your leadership in a way that will help both you, your patients, and your team.
Yeah. I think
So
I think when yeah I think a lot of hospitals might need some help from your side explaining what is lean thinking, and yeah, especially in healthcare, like lean thinking. Can you describe that, what that is?
yes, so I will just give what it is to me because for many people it means very different things. And for me, well, if you take the word lean, it's like an indication that you want to remove all excessive waste from whatever you're doing. So that would be the small definition, that you want to add value to the lives of the people you help, and to do that, uh, it's better to put your attention on removing things that are not of value that's way more lucrative than focusing on ever better improving the treatment itself. So it's not the idea to maybe go from when you have a consult. It's not the idea that you spend less time with your patient so you be more productive. No, it's better that everything that is needed to prepare for the consult, that is efficient. So you be there present for the patient with all your thinking, your hands, and your heart. So that's how I like to define lean. And because it's a way of thinking, it comprises of a set of principles, which when you join them together and build a system, a management system, I would call it, then that system would help you to have everybody in your organization participate in improvement. So you need two things. You need like a purpose. You need to remove everything which is not helping your patients or not helping your team. And you do that by having everybody involved. And that you must really like that, because I know you're very much engaged with people engagement and making sure that that everybody is really up to joining the team. So I think that would be the short explanation. So it's a particular way of looking at your work, and it's also a management system to make sure that everybody is helping making the world better.
Yeah. And how easy is it in like an industry like healthcare, who is like really under pressure, to keep these minutes, to keep the time for the patient, instead of like cutting off that time and reducing?
That's really difficult, because in healthcare, like in many other industries, there's still a preference to do what I would call classical management. So it's still whenever there need to be like a lowering of the cost of the expenditures, that's normally they start there. So they start with the wrong problem. Yeah. So I think that the biggest obstacle for healthcare to get really good and make sure that everybody in the team is doing his work with pleasure and not getting burned out, is that they start redefining their problems. And this is the most difficult, but also the most important step. So to give an example, there's many, it's at least in the Netherlands, but I think in many other countries as well, everybody is shouting, we have personnel shortages. We don't have enough nurses and doctors and policemen. And so they say we have staff shortages. But the problem with staff shortages is it's not a problem. It's a solution disguised as a problem. Because when you say you have staff shortages, that means that you already know I need more staff. So actually you're saying I need more staff. You're not saying we have staff shortages. You have the sense that you need more staff. So I see it as a purpose of me in my book to not help healthcare get more solutions, but get better problems to solve. Because if you redefine your problem, let's say that we want to redefine staff shortages, we might say, okay, we can't give our patients what they need. And if you say we can't give these patients what they need, at least you admit that that's what you want. It's your purpose to give patients what they need. And then you can ask, okay, what's keeping me from giving patients what they need? And then you find all kind of stuff. Not only that you maybe have that your team is too small, which might be a reason, but mostly it's because your time is going to the wrong things. Yeah. I do a lot of, well, you could say research or analysis in healthcare institutions. And what I do, I just ask questions and go to observe in their workplace. And sometimes I ask, okay, do you need to search for something sometimes? And they always say, yes, we have, sometimes I can't find the information on my colleague or whatever. And I found out that on average, they lose about 50 minutes a day or maybe an hour searching for things. And what if you would solve that? What if you never have to look up that information, or that you never have to figure out, okay, where's the medication for this patient? Then you would save an hour a day. So an hour a day, that is, and if we take 50 minutes, that it's maybe easier. That's about 10%. So, and in the Netherlands, 1.3 million people are working in healthcare. So if they all would save 10%, then you would have 13,000 people.
130,000.
No, 10%, 130,000. Yes. Oh, so
Yeah,
thank you for the. Yes, I'm an engineer, but it doesn't mean that I'm always.
Nice try.
My math is off. Even I am so surprised about the big numbers. Yes, then you would save up 130,000 jobs.
Yeah.
So, and we have in the Netherlands approximately about the same number of vacancies.
Okay.
So that means that if we the only thing we need to do is make the workplace self-evident, so we don't need to search, and then we have no more vacancies or no more need for extra people.
Yeah.
So that's, and I think that's why I have called the book Lean Thinking, because it's how we think about the problems we have or we sometimes don't have.
Yeah.
So that, I think, would this be an answer to your question, or?
Yeah, for me it's clear. So
yeah. Okay, but maybe you were.
I still remember when we visited a big hospital in Holland, like I think in the meantime, like 6-7 years ago, with Mr. Shingo, that he asked the management of that hospital if they were interested, like in an honest reaction of the system they built in that hospital, and
Yes.
that he was really upset about the KPIs, the things that were measured in the hospital, that it was not at all about like the health of the patients, that it was like about cost cutting and reducing the time. And you remember that?
Yes,
visit?
I remember very well. And this was already a hospital which was considered to be quite far in their journey. So, and at least they had KPIs for different perspectives. So that was good. But what I also remember is that he was mostly upset not because they didn't measure safety, but they didn't paint a picture of what actually was going on. So they couldn't tell him exactly what does safety mean, because they had I think they calculated the number of incidents in the hospital each, I don't know, each day, each month, each week. I'm not sure of the period. And then he asked, of course, okay, what happened here? And then they couldn't tell.
Yeah.
And that was what's most upsetting, because then it's just for the show.
Showcase was it?
It was more a showcase than it was an actual way to understand what's happening in their hospital.
Yeah.
And that was what most I think, because in that same period he went to a conference as well, and there he said something very interesting, because he said, well, I don't care about the waiting list in a hospital.
Yeah.
Because you have defect. So go. He didn't understand that that as long as the quality wasn't under control and there wasn't a zero defect situation in the hospital that they would worry about trivial things to him, like waiting lists.
Yeah.
So that was also very interesting. Yeah.
Yeah, and did the situation change? Like we visited that hospital like 6 7 years ago. Like if you compare the situation right now to 7 years ago, do you
I
see
have
like
to admit,
evolution?
I haven't been there
No, but in
afterwards. So,
general,
oh, in
in
general,
general,
yes. So I thought you meant this particular hospital. Um, well, I'm not sure. Yes and no. So yes, more and more hospitals understand that they need to improve, but um, um, the they still lack the true north or the zero defect
yeah.
mentality, I would
Mhm.
say. So in the Netherlands, I think that that's also a bit in our culture. We tend to improve away from the status quo
Uh-huh.
instead of towards our ideal.
Yeah,
So that's why I believe that my books are still relevant today, because I take it from the other side. I take it
yeah,
from the ideal and then go backwards. Okay, what do we? So the question is, so they are, well, there's a great movement on what we want to improve,
mhm,
but there's little to no movement on what needs to be improved, because these needs are still defined by the people who make the budget.
mhm,
So they think that needs are defined by the budget. We have enough or we don't have enough budget. I mean, last week, the president of the Society for Hospitals in the Netherlands was on TV because 60% of the hospitals are about to lose money this year.
mhm,
And then his story was that the only way to solve it is if the government, so that's us, would pay more.
mhm,
Because the problem is, yeah, well, we need to increase the salaries of the nurses, so everything is go. So he assumed that costs are always goes up, because he confuses costs with expenses.
mhm.
So even at that level where they only talk money, they don't understand money. So that's, yeah. So I think that's the biggest problem.
Yeah. Yeah.
So
Now,
yes.
now you work. Sometimes you work in Belgium. Sometimes you work in Holland. Is there a difference between Belgium and Holland?
Yes, very much. You could even say that I think that although we're neighbors, the cultures of the two countries couldn't be farther apart than
No.
any other European country, I
Yeah.
would say. So, and for me, that at first it was well, I needed to adapt to that, because I'm I'm not necessarily very comfortable with hierarchy. So and sometimes I always I maybe say I'm direct, but I also say things that they think you shouldn't say, or at least then it should go through the boss.
Uh-huh.
So so the communication lines are different. But in the end, the interesting thing in Belgium is that it depends also on individual leaders and what they want as a hospital. So the hospital I'm working at, as a turnout, they have they're very open to learning, and maybe it has to do with me, could very well be, but I haven't met such learning
Yeah.
mindset, or a growth mindset, maybe even. I met it more in the Belgium hospital than in the hospitals in the Netherlands.
Mhm.
But in the Netherlands, you have also culture difference, because if you go to what we call the longevity care, so I went to an organization for for the intellectually disabled, and there those people working there, the nurses, the caretakers, uh, they also were very open to learning. So I think that hospitals in itself also have a bit of a particular culture, which is also dominated by the physicians, who mostly are like a separate group. So they have their own column, and they only talk to each other and to the executives. So and of course for the decision making, I mean. But for the daily work, they need to talk to everybody because it's teamwork. You can't do it alone. So that's also might be somewhat of an issue why in hospitals this is maybe more difficult to introduce. And the other thing is that if you want to organize it, hospitals are a concept of hundreds of years ago, and we still do it the same. And that means that all disciplines and each step in the process from the patient perspective is organized separately. And that's still the case. So the hospital is more like a shopping. It's more like a shopping mall. There's all these different stores, and they do all these different things. But you as a patient have to make sure that you flow into the right store in the right order. So that's also a very difficult, but that's also where the biggest challenge, but also the biggest opportunity lies. So if hospitals understand that there's a patient flow and they can best organize everything around what they need to do for these patients, they can improve quality and their productivity as well in one change, I would say.
Yeah. Now, how easy is it, like in healthcare, to free up time to do like trials and to change and to find these aspects of waste? How easy is it? I can imagine that it's like terrible, difficult to do this.
Yes, you're right. So it's very difficult to make time. So it always starts with somebody who has the ambition to be excellent, because if you don't want to be excellent, please don't start. I mean, because then there's always a reason that the status quo will suffice. So you need to want to be excellent, and you need to want to learn. And if patient. These, yes, and be patient, yes, and but not be a patient.
Yeah.
And but then if you have that, then it's as difficult as in any other organization, in the sense that yes, you need to free up time, but there's a lot of time already wasted that can easily be removed. So I would suggest that you need to have big dreams, like a True North, and you want to be zero defect, but you can start very small. What if you would save 5 minutes a day? So you start with a small team, and you take like 15 minutes a day to save 5 minutes a day. Then you after 3 meetings, you're done. You could say. So and then the same calculation as we made earlier, and then it's 13,000. So if you would save, because then it's 1%. So if everybody would save just 5 minutes and everybody can shave off 5 minutes of his own agenda. So you don't need the team anymore. You just have to figure out, okay, where do I lose my time? And that's, I would say that's the best. So make it small, that you can't say no, and then get together and keep it simple. Make it small. The thing that makes it a bit more difficult for healthcare is because nobody gets taught these kind of ways of thinking and these methods. When you're in a factory, at least you have process engineers, and they understand that you need a process with the right tools, etc., and that needs to flow and it has to be efficient, etc. So they think, what should the process do? But I find in healthcare there's two groups. There's one group that says, okay, what's the content of the work? So it would be the doctors and the nurses. And then you have a group and they structure it. So they say, okay, what should be the procedure? And a procedure is which steps in which order. And the structure is also which department is headed by which manager, etc. So you get structure and you get procedures. But procedures don't tell you how to do the work and how to do the work correctly and efficiently. So that discipline is missing in healthcare. And because there's a great pride in healthcare on their work and on doing a good job, so they're reluctant to rely or even invite this discipline of process thinking into their world. So yes, so it requires a lot of commitment from them beforehand, because they're going to do something that they not yet understand, because they have never been taught. And everybody who's working on healthcare, like healthcare insurers or managers or the inspectorate, or they only think in procedures. So what they do is, when they are not happy with the quality of healthcare, they make more rules. But they never ask, okay, what's the root cause of the quality, of the poor quality? And then mostly these root causes are their own rules. So instead of eliminating rules or improving on the rules, they add rules. And that means that now I think 40% of the people working in healthcare are not working, they're working on healthcare and not in healthcare. So we have 60% doctors, nurses, caretakers, etc., and 40% other people. And still, these doctors and nurses, 1/3 of their time is spent on actually helping patients. 1/3 of their time is wasted, and 1/3 of their time is dealing with the bureaucracy made up by the other 40%. So, well, so here there's a huge potential, but we need to change the thinking first, because they need to see it for themselves before they are actually, they need to become problem aware before they can start asking for help, I guess. So that's the biggest hurdle, I would say.
That is also what when I see in the scans I did, I developed that for the lean scan, and maybe I can show you like an example of something. This is for example do you see it on your
yes
mobile?
Yes, but I see it on my mobile, but I put on my reading glasses, because I'm above 50 now. So no worries. Now I can see it very well. Yes.
So the left side, maybe in short, I show then what is the difference. So what you see on the left side is like a typical like profile of a nurse in Holland, and the right side is like the organization, how the perception of the organization is in the eyes of the nurse. Now, what you see in a lot of cases is that what they see is like the organization is like mainly 0D. That means like a lot of things are not yet standardized, like it's like chaotic, and the other part is like that there's like a lot of pressure on these employees to perform. When you look at the profile of the nurses, then you see like the blue part, it's the 4D part. That is the part that is the caring part. That's their purpose. They want to take care of the patient. They want to do their work like really, really well. They have like the 3D plus side. That is like the hard side. It's like showing empathy and taking care and like, creating a nice environment for them. And then like they are like also 3D, and in this case, like this is like a profile with a lot of 2D. So they expect, and for themselves they are like structured. But the main thing for me is like what you see is that like, and in nearly all cases I saw in mainly in Holland, is that like the 0 and the 1D part in the organization is it's so big, like and it's so
Yes, it
easy
is.
to show the management, like what is going on. And for me, this is the main reason. But yeah, you have to confirm that people are just leaving healthcare because the pressure is too much, and like it's like in their eyes it's chaotic.
Yes, exactly. I think I fully agree. Very interesting graph. Thank you, Jim. So yes, and the one other part which is enforcing this is that people are doing each other's jobs. So
Yeah.
the so the care the doctors and the nurses, they need to administer and register so they can provide accountability
Mhm.
that they are doing a right job. But this is required by the health insurance. So the health
Mhm.
insurers want they enforce all kind of administration just to know that so nurses can prove that they're
Yeah.
doing a good job.
Uh-huh.
But there's no evidence whatsoever, and your graph actually proves that you can assume that a nurse won't do a good job.
Mhm. Yeah.
So if you want accountability for the work done by nurses, then at least require the hospital to do that work
Mhm.
and let the hospital hire an administrator.
Mhm.
But I would even say that if the healthcare insurance is not, if they think they need to have nurses document their time,
Mhm.
they should pay for that. So the one thing that I can come up with, which is in line with classical management, but would maybe improve the situation, is that if somebody burdens another person with his mistrust, then he should pay for that.
Yeah.
So at least we pay for the time of the nurses to fill in the forms. So maybe
Yeah.
that's but
Yeah.
maybe that's
Yeah.
where we're headed, because it's very difficult to yeah. But the healthcare insurer themselves, they're doing no accountability,
Mhm.
whereas actually that is their job. They
Yeah.
have to ensure that I get the right healthcare. So
Mhm.
they have to. I never get a message from my healthcare insurer who says, "Okay, this is my performance, dear patient. I made sure that you get that you can go to the physiotherapist this month because I have contracted them, and I made sure that I made a contract that they can pay their family a decent wage, and I made sure that when you go to the physiotherapist, that's paid for, because then we save the money of you going to the hospital."
Mhm.
Never. So they should be accountable for where they spend their money, but they're not. They
Yeah.
ask the nurses to be accountable for where they spend their time, and the consequence is that they hardly have ever any time to be with the patient.
Yeah. Yeah, and
So it's
that is what you see in the graphs. Like it's like
yeah,
the distrust and like the bureaucracy. That is like the
yes,
bureaucracy that's like 0D, and the 1D is like the yeah. You can never like ask people to perform like at their maximum potential if you don't trust them. Like
exactly.
that is
Yes.
impossible.
So yes, so that's so my idea is how to solve this. Um, my idea is the only thing we can do is disruption. And what we need to disrupt is the leadership. And that means that because I think it was Clay Christensen, he wrote a book, The Innovator's Dilemma, and later The Innovator's Prescription. And he's gone, unfortunately, but he was a former Harvard professor, and he understood the flow of innovation. So innovation starts somewhere in somebody's shed. He come up with something primitive, but because it's new, what they do is they sell it to people who don't have the product yet, because they don't care too much about the quality, because it's better than nothing. And then with the help of these people who don't have access yet, you develop the product, and then you with a computer, you start with a counting frame, and then later you make a very big computer. So when you have a very big computer, it means that all the problems need to come to your computer. So it's like a hospital. All the patients have to go to a hospital, whereas healthcare started with medicine men and other people in the tribe who tried to help people when they got sick. And now we need to go back. Like we now need the invention of the iPhone, because the iPhone is this big computer in your back pocket at the fingertips of the user. So we need to change healthcare like an iPhone, but now we need to change the leadership. And the leadership should be with the individual care providers, because they don't have access to leadership yet. So if we give them leadership and they start using it to make cells and teams of excellent care, they can then suddenly we don't need the hospital as the current concept anymore. We need maybe clinics, and we need specialties, and we need ORs, of course. But many of the things that happen in a hospital, why should we all travel to that hospital? So I think that's, and it doesn't mean physically, but we have to, and that's where my books come in. I think that the best way to go about it is don't worry too much about these 0 and 1D, I don't know how you would call it, but overhead. This overhead. Just ignore them and start giving leadership and teaching leadership to nurses and doctors. And if they start to understand that leadership is mostly about solving ever bigger problems, they can start solving to solve their everyday problems, like looking for stuff. And then when they know how to do that, they maybe start to do something bigger where they need a colleague or a team, and they start changing things within the team. And then their business or their part of the process gets more and more efficient and more reliable. And then they can start making it bigger and do multidisciplinary things. And then I think there comes a moment where they can say, we don't need you anymore, to the management and to the, but they need them now because they get budget and I don't know, and the decision making is going all up and then down. But if they stop ignoring that and they just change the process for the betterment of the patient, that will free up enough time to figure out a way to keep doing that without the bureaucracy. So that might be the route to, and we need technology for that, and we need all. It sounds simple, but it's not easy, I would say. But I think that's that we need to start in the workplace by teaching people how to solve their own problems, so they don't need, because the biggest problem of these nurses and doctors, because they're very passionate and they want to do a good job, but because they don't know how to solve their own problems, or they're not allowed to, or whatever obstacles there are, they also point to these to the other people. You need to solve our problems. But like when you're overburdened or whatever your problem is, the management and the healthcare insurance, they don't care. To them, it's not a problem. It's not even a problem now that like 40% of the newly trained people in healthcare are leaving the sector.
Yeah.
And still they don't define that as the problem because they don't see that they cause it. So we need to take it from a completely other direction so that the dependence on solving your problems by management or staff, employees, or maybe even outside businesses, or I don't know. Yes, we need to change that. So that's what I would propose for the future of healthcare.
Yeah, yeah, and if there are people watching who, yeah, who want to use the scan for free, I will show maybe the QR code, so they can scan this code. Is for free. Then they can see the situation also in their hospital or in other, like it does not has to be in healthcare. If you scan this code, then you get like a free scan to see like how good or how bad is the gap or the match with with the people you are working with. But it's up to you. If you use it, it's completely free. Now my last question: how do you engage? What's your advice to engage people in healthcare?
So well, to engage with me or me engaging with them?
No, what I mean is like, how do you keep nurses in healthcare and avoid that they are leaving? So do you keep them engaged,
Yes.
that they are
Well,
not leaving or slowing down?
well, yes. Then we're nicely circling back to the start of our talk.
Yeah.
That's you need to say and explicitly say that it's a problem. If you don't care about it, then well, yeah, that's horrible. So and that means that if you're in an organization where it seems like people don't care, I think you could at least start a conversation with them to understand their thinking. So even if you have a bad boss or I don't know, 0D management or what you could call it, still the key is listening. So start a conversation and ask them what they think about the situation, how they think they could influence it or not, what is keeping them from solving it. Is there anything they need? Because maybe you as an individual nurse, maybe it sounds a bit too ambitious, but maybe you can help them. Maybe you already help them by going to them and listen to them. Because we often say, my boss needs to listen more. Well, I had in my consultancy practice, I had an exercise. It's called How to Manage My Boss. And I asked people, okay, tell me about your boss. And most people then write something down they don't like. Okay, so and then I asked them, okay, when that happens, for instance, they say he never comes to the shop floor. Okay, I say, okay, when they do, what do you do? And then, we laugh at him and we say, finally here, etc. I say, okay. So then I ask them, okay, what do you think that boss feels at that moment when you do that? You think he's coming back?
Yeah.
No, not really. I say, okay, so you're much part of the problem as your boss. So if you want to change and want to have your boss come to the shop floor, be inviting. And if he's not coming, make an appointment and start listening and say, okay, what's keeping you from seeing us? And he will tell you a whole story, because the problem is never or hardly ever the individual. So it's not a bad boss. It's mostly always a bad management system. So they have to keep up with whatever is required from them. I mean, I have seen so many managers that spend hours and hours in Excel or wherever, and they often also don't believe that that would be the best way to spend their time. But when they go to report out with their boss, and they don't have the Excel sheet and they can't tell the numbers, well, they get punished for that. So maybe we should better understand the other side of the story. That would be a great way to. That's where innovation comes from. When you rub against, something that is maybe not exactly in your comfort zone. So that could be a great way to do it.
Yeah. Thank you very much for being here. If there are people in Belgium or Holland who are looking for like a healthcare expert, a lean expert, Arnout is the right person to contact.
So anybody is most welcome. I wrote the book also because I think it's fair to people to let them first experience and read about my story and about what I'm about, because it's quite a big step. Like I said, it's not nothing to say I want to be excellent. So I think it's fair that you first read about it and then understand, okay, is this for me? Because we need to be a match for each other. Not everybody is willing or in the position to be this ambitious about healthcare. But if you do, please read my books. They're available in any of your favorite bookstores. And if not, you can buy them on my website. And for anybody who thinks, yes, I would like to do something, but I don't know what my next step should be. Should I go to a presentation? Should I read a book? Should I already do a project? Whatever. I offer anybody who is in that position a free strategy call. So you just can book a call with me on my website, and we will discuss for maybe 40 minutes what your situation is and and we together figure out what the best next step for you could be. Anything that would help you.
Yeah.
Okay. So, yeah.
Thank you for being here, and
yes, thank you so much for inviting.
We meet somewhere after Christmas.
Yes, we'll do.
See you.
Okay, thank you.
Okay, bye-bye.